no two experiences with breast cancer are the same, and knowing that can start a very important conversation. Hello everyone, I'm Neki Mohan, and I'm your host today. Breast cancer is the leading cause of cancer death among Black women in the United States. Black women are also more likely to be diagnosed before the age of 50. So much can be done to improve the chances of survival, and having this conversation is where we can start. Today we're joined by breast surgical oncologist Dr. Kerry-Ann MacDonald from Baptist Health Cancer Care. Great to have you here, Dr. MacDonald. And breast cancer survivor Tamara Rodriguez. Happy to see you again, Tamara. Thank you both for joining us. Before we dive into today's subject, I want to remind our viewers to send in your questions and comments in the comment section throughout this discussion. We're here for you and happy to answer any questions you may have. We're going to start with Tamara. Tamara, you are a survivor, but you're also an advocate for those struggling with breast cancer. Tell us about how you felt when you were diagnosed.
Well, Neki, on the eve of my 10th year anniversary, I often reflect about that day. And I think that if I was to be diagnosed today, I would have that same sense that I had then, which was a sense of fear. I felt discouraged. I felt deflated. And of course, I thought, the end was near and that it was a possibility that I wouldn't see my girls grow up.
How did you discover it?
I had a lump right
a self-check?
here. Yeah. Well, I don't know that it was a self-check, to be honest. I think it was just, it happened that I was touching my chest and then I felt the lump.
Wow.
Yeah.
Dr. MacDonald, although Black women still have a 4% lower chance of having breast cancer than white women, they have a 40% higher chance of death. Why is there such a disparity?
Yeah, every time I hear that statistic, it's always so startling. And I think there are a lot of contributing factors to that. One is delay in diagnosis. So Black women are often diagnosed with more advanced cancers and at later stages. So it's therefore more difficult to treat. In addition, I think there are some socioeconomic factors such as insurance disparities, lack of insurance, as well as just access to care, Do you have the same access as someone else who lives in the same neighborhood to the same kind of treatment center? I think there's also some disparity in terms of education and knowing kind of when to get your breast imaging. So, there's varying degrees of healthcare literacy. There's issues with transportation. Many people work 2-3 jobs, possibly. So it's difficult to get to those appointments. And lastly, there is some ongoing research looking at biological differences in different breast cancer subtypes in different racial and ethnic groups. And so I think that's going to provide a lot of insight as well. And so there are many efforts around the community to try to decrease disparities. And so it's important to participate in those things so that we have more healthcare equity.
Yeah. And that's why research is so important, right?
Yeah.
And Tamara, you really advocate in the community, especially culturally, because in so many communities, we still don't talk about breast cancer.
Yeah, no, absolutely. And I think it's taboo. When I wanted to share the news with the community, my family was like, well, no, we don't talk about these things. And I felt strongly that it's important to talk about it because folks needed to see a young person, 35-year-old woman that had no history of breast cancer in her family, was able to get diagnosed with breast cancer. So I do think we have, in addition to the socioeconomic issues, transportation issues, we do have cultural issues that we have to address as a community. So I've tried my best to address that, as well as participating in research. There isn't a lot of data. There's not enough data to include Black women in the conversation so that we can establish the baselines a lot. And I don't know, Doctor, if you'll agree with that. A lot of the research and the data is often done with non-Black women. And so even with some risks that we might have that were not being communicated to us is lacking. Right?
Yeah, no, I absolutely agree with you, and I applaud you on those efforts. I mean, I think it's very important to not be scared to participate in research efforts because, there were so many women who came before you that participated in research and gave you these medicines or gave you this more conservative surgery, so you should, put yourself out there a little bit and participate in these trials because, the purpose is they're not going to do any harm, but it can only be of some benefit. And the other thing about kind of cultural things and talking amongst family, I think sometimes people don't know to ask questions about their family history because they don't really know why they're asking these things.
Correct.
Maybe. So, right? So I think we should change the shift towards like prevention, early detection, so that if you know your family history, I know my mom had breast cancer, my grandmother, then I might be screened a little bit differently, and therefore, if there is a cancer, I can detect it at an earlier stage. So I think it's important to kind of change that.
Yeah, absolutely. And you mentioned, Tamara, you're on the eve of your 10-year anniversary. People will hear your story and schedule their own mammogram, hopefully, right?
Hopefully, yeah.
What do you know now that you wish you knew then?
That there's hope, right? So when I had that sense of despair, I felt defeated, I felt deflated, and maybe I didn't realize the advancements that were available, right? I often say Baptist saved my life, right? Because there was advancement. It was detected early, so I was able to get treatment, to have my surgeries. And so what I know now that I try to share with others is that there's hope. And that early detection does save lives.
Yeah, and back to Dr. MacDonald, like once you're diagnosed with breast cancer and you're a survivor like Tamara, how do things change in terms of checkups and follow-ups with your doctors?
Yeah, that's a great question. I mean, once you're diagnosed with breast cancer, it's always kind of like a part of you. It's part of your medical history. And you've kind of been diagnosed, you've gone through treatment, and now you're living a full, healthy life. So the things that I think are important during that time are to, keep close connections with your doctors, because you want someone to check over you, to check your tumor markers, to make sure everything is okay. On the same line, making sure that you're getting your breast imaging. Every imaging protocol is going to be individualized, but making sure that you're sticking to the plan. The other thing is self-breast examination. So many women don't do them, but after you've had surgery, radiation, the breast is different. It feels different. It may look different. And so you want to know kind of what is my new baseline, so that if there are changes or you discover a new lump, you kind of know that this is new and should be brought up with your physician. And then lastly, I would say maintaining a healthy lifestyle. I think it's, when you're diagnosed, a lot of things are going through your head and you want to kind of like fix all the negative things in your life and be a lot healthier. And so just like anything, like exercise, you start off really good and then you kind of slack off, but you just need to maintain that even for many, many years beyond your diagnosis.
I would also say to check the other organs too is something that I've had to remind myself, because I tend to only focus on my oncologist and make sure, are you sure I'm okay? And kind of like going too much, right, to the oncologist to make sure. And it's like, okay, but the heart is also still needs to be checked, the lungs, everything. So I also encourage women that have had breast cancer that are now in remission to also remember that there's other parts of the body that we need to stay on top of.
That's a great point, because some people go through chemotherapy and it affects your various organs.
Correct.
So
but that's why it's good to be in a good group, because you then communicate to them, right?
Yeah.
Correct.
Because you start a whole new protocol.
Yeah.
Dr. MacDonald, once you're officially diagnosed with breast cancer, your cells will get checked for certain features. Let's talk about triple-negative breast cancer and how Black women are specifically affected. That's often a very terrifying diagnosis.
Yes. So triple-negative breast cancer is considered a more aggressive subtype of breast cancer. Specifically, it's characterized by lack of estrogen, progesterone, and HER2, which are proteins on the cancer cells. And so triple-negative breast cancer is immune to certain targeted treatments that we use to treat other breast cancers. So the treatment of triple-negative breast cancer is surgery plus or minus radiation and chemotherapy. So 15% of breast cancers are triple-negative, and Black women are certainly disproportionately affected by triple-negative breast cancers. So we're 3 times more likely to develop triple-negative breast cancer compared to a white woman. We're 28% more likely to die from triple-negative breast cancer. And I think this also contributes to that 40% mortality.
When you die, people learn so much about themselves when they're going through a cancer diagnosis, as you know well. What was the most difficult part of your journey? And what can you tell somebody that's, may get this diagnosis or be going through with it?
Sure. So I think for me it was twofold. I think I realized that I was in full control, right? I was very active. I am a very active person. And so to have to stop and realize that you're not in full control was very humbling. Because I had done all the right things, so I didn't expect this to happen to me. So that was very difficult for me to navigate. And I think another part that was difficult for me that, again, we don't talk about enough as women is the body changed so much, right? And that creates issues with intimacy, right? And even the way you feel about yourself. And I wish that there was more conversation about that because there's also...
Well, that's why we brought you here.
There's also solutions, and there's groups and there's cosmetic stuff that can be done. There's just so much. But I do think that that's a difficult part is that your body changes, your body is altered. And so when you look at yourself in the mirror, you're not that same person. So that was challenging for me.
Yeah, no, good, a lot of good points. Mm-hmm. Identifying certain risk factors in our day-to-day lives, Dr. MacDonald, can promote an overall healthy lifestyle, because that's what we all want, right? Are there certain risk factors that predispose Black women to breast cancer, and what can we do to be more proactive about our health?
Yeah, I think there are common risk factors that we think about, family history and the like. Breastfeeding is, at a lower rate in our population, and breastfeeding does protect you against breast cancer.
Wow.
Because it delays kind of the initiation of the menses. So, and women who do breastfeed more than 12 months have a 4% decreased rate of developing breast cancer. And so I think that's one part of education that is important. The other piece is stable body weight. And so, when you go through menopause, you don't feel so well, you don't exercise, but the fat tissue carries estrogen. It also helps to synthesize estrogen and can lead to ER-positive breast cancers in menopause. So I think maintaining a stable body weight, exercising 30 minutes every day, limiting alcohol intake, not smoking, all of those things are very important.
Yeah, no. All great tips. Let's take some questions from our viewers now. Our first question is, how likely, this person wants to know, how likely they are to get breast cancer if their mom and grandmother had it?
Yeah, so when we see breast cancer in multiple generations, we always think about a hereditary breast cancer ovarian syndrome. And so we would recommend that that individual pursues genetic testing to look for a genetic predisposition. And obviously meeting with a genetic counselor and having genetic testing.
That's why it's good to have conversations.
Yeah.
Now, what age should someone start getting screened for breast cancer is our other question. And we've seen guidelines roll back the last few years.
Yeah, I will stick to the 40 years of age.
40.
I think 40 is very important. I'm seeing a lot of premenopausal breast cancer in people who have no family history. And I think part of that is environmental. There are a lot of things, in the environment that we're exposed to that we don't know. We like to get our nails done, for example, gel nail polish, UV light. There's just like a whole host of different things.
I noticed you don't have your nails done.
Yeah, I know. I raised my hand.
Tamara,
No. But you know what I'm saying? And kids are on birth control from very young
We
ages.
talk about birth control forever because I have a lot of feelings about birth control.
So things of that nature. So
talk to me. Could I say also, is it I've been told, and I'd love for us to unpack that if you should when you speak to your children, if you've been diagnosed, like in my case, I was diagnosed at 35, I've been told that my children should start screening 10 years earlier than the year that I was diagnosed. Is that consistent with what you know?
Yes, that's consistent.
Okay.
That's exactly
so my girls will have to get screened at 25.
Correct.
Okay.
How, and Tamara, you can take this question. This next question is, how best can someone support a family member going through breast cancer treatment?
Yeah, I think, know who you're dealing with. So if the person is very private, just give them the space, right? But if they reach out to you, be there for them. It's very tricky. I think folks don't know what to do, right? Should I call? Should I not call? Should I visit? Should I not visit? Should I support? Should I not? The answer is all of the above, right? I I enjoyed receiving messages when I was, doing my chemo treatment. I might not have responded, but when folks would send a message of support or even a joke, it made me feel good because it made me feel that I wasn't alone, right? So I would say the best way to support is to give the person space if you feel that they need it, but also open your arms to them if you feel that that's what they need as well.
Maybe ask them what they need.
Ask them what they need, absolutely. Yeah.
Final thoughts, Dr. MacDonald, as we wrap up this important conversation today?
Yeah, no, I think this was a great conversation. I think, just getting out there in the community, doing more talks like this, increasing awareness, just reaching out and so that people can develop trust and understand kind of how important this is.
And to look in your community, because there are always like free mammograms and stuff in breast in October. See what resources, as we talk about disparities in health insurance.
Exactly. We have a mamma van that goes out to different churches, schools, all around Palm Beach. So taking advantage of that is key.
Yeah. Final thoughts, Tamara?
I think conversation is really important because people can understand that early detection saves lives, that there's opportunities for treatment. So I agree with Dr. MacDonald that doing more of these types of conversations are critical.
Yeah, and the best thing is more people are survivors these days.
That's right.
And that's important, to have hope.
Yeah.
Dr. MacDonald, Tamara, good to have you here. Thank you so much for this great discussion today. Remember, viewers, to hit that subscribe button on our channel right here to keep up with the latest health and wellness information and tips from our experts. You can also connect with us on social media channels. Check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all episodes of the Baptist Health Talk podcast as well. On behalf of everyone here at Baptist Health, stay safe, stay healthy, and thanks for watching.